rolled up my sleeve, and it was a little poke. It was painless. It was expeditious, very quick.
I feel like that's part of my role as a PA, educate the public, educate my patients, educate my family, educate my friends.
I feel so honored, privileged, grateful, jazzed.
It was about mid-December, and we had gotten word that the vaccine has officially arrived in New Mexico, and it went straight to one specific hospital, Christus St. Vincent. It's in Santa Fe, and this was the first hospital in the entire state of New Mexico to get this vaccine. So this was a big deal. Dominic was one of the first in the state, not only just his hospital, but the entire state of New Mexico.
I received the vaccination on December the 14th, and my second 3 weeks exactly following on January the 4th. Soreness at the injection site for about a day and a half, 36 hours. And then just after my shot that evening, I was like extremely tired. So fatigue and lethargy. But after a good night's sleep, I was fine. Being a nurse and representing nursing and my frontline providers, I was so privileged and honored and genuinely grateful because I manage a staff of more than 140 providers, and we take care of patients that have been compromised by the virus, not only in our small little city of Santa Fe, but the Navajo Nation, other areas in New Mexico, Arizona, and Texas as well. So exceptionally special is an understatement for receiving vaccination.
He wanted to try to dispel any of those fears by jumping to the front of the line there. And I think you can see that just throughout any community, not just a hospital or the state of New Mexico. There are those that are concerned about getting this vaccine, but then we're also seeing others that are stepping up saying, hey, I want to get this and I want to get my shot publicly.
So this was me receiving the vaccine, and being the first one to receive the vaccine was my little 15 minutes of fame.
Well, I have to tell you, even interviewing him, I could feel his excitement. He had a big grin on his face, and he was just so excited to be able to get the vaccine first and also be a leader for his team. He is a nurse manager, so he wanted to make sure that he was able to lead by example.
The vaccine was simple, easy. I just believe everyone should do it as soon as they're able to. But the duration of this pandemic has just been so extreme, and working so closely with expanding containment units and the process, it's been just really challenging. One of the exciting and grand things about it is wheeling out recovered patients. So that's really great. But dealing with death weekly is really challenging for everybody on the unit, especially the families who have to say goodbye on Zoom. It's heartbreaking, heart-wrenching, but I have the most amazing crew of intensivists and hospitalists and respiratory therapists, our physical, speech, occupational therapists as well. Besides our nurses and our aides and our housekeepers, everybody really works as a team, and we're persevering to really get this done. So we're here, but it's not easy every day.
I mean, COVID changed everyone's life, right? And the news industry is no different. As a journalist in this time, you're hearing the stories firsthand. You're hearing about the healthcare workers that are putting their lives in jeopardy every day to take care of people. And when you're telling these stories, it's heartbreaking to hear it firsthand, what's going on in your own community that you're serving. And it's even that more important that we continue to cover this and that we continue to share the word, the latest updates regarding how you can better take care of yourself, when the vaccine is available in your community, who's eligible at this phase. But, it's a heavy time for a lot of people.
He is, I'm hoping, getting those antibodies. And this is the safest way a baby can get it.
We saw this community response of this physician assistant who was detailing for us on Facebook her reaction to the shot. It was this new vaccine, no one had had it before, and she was listing out every symptom that she was having. But then we realized she's a new mom, and we haven't heard a lot about pregnant moms getting this vaccine and what it's going to mean for them.
I ended up putting it on a 1 week post-vaccine post on my Facebook so that I could be transparent. I could tell people, hey, not only did I get the vaccine, this is what I felt, and these are why I think I felt that. Like, this correlates with what we know about science.
She really felt like it was her duty to be able to pass along to people in a forum where she could interact with them one-on-one what was going on and what to expect, and whether or not, she was experiencing anything that was out of the norm or totally normal. She found another study that same researcher was doing, and it was whether or not moms who'd been vaccinated could pass on those antibodies through the vaccine through their breast milk. So she's been saving her breast milk, and she's going to ship it off to Mount Sinai. And from there, they're going to see if that antibody response that's in her body can be passed on to her newborn.
I was really interested in getting involved with the breastfeeding trial because I'm a medical professional, I am breastfeeding. I knew that this was something brand new. This was going to be historic. They had asked for pre-vaccination samples and then several time periods post-vaccination. I'm not doing a whole lot of extra work than what I would have been doing anyway. I just work part-time as a PA in pediatric critical care. And on the days that I work, the ones that match up with the days that the study wants a milk sample, I just pump an extra amount that they need into an extra bag. I freeze it nice and flat, so when it is ready to send, it will be shipped. After my first vaccine, I was really hyper vigilant. I was watching for everything. I was watching his feeding habits, his diaper habits. I was feeling his forehead like every 2 hours, it seemed like. And I was just being really, really careful. I got my first vaccine right before Christmas. And so that week of Christmas, my other kids were home as well. And so I had lots of eyes and ears to be watching him. And we didn't see really any change in like his fussiness, or he's never irritable or anything like that. He did have one small, what I would call like a low grade fever, like 100, 100.1 on day 4 or 5. And it kind of seemed to correlate with that, the timing of when a little antibody response in me may have occurred, that day 3 to 5, that first surge of antibodies. So I don't know, like whether or not it had anything to do with that, who knows? The second dose of the vaccine was 4 weeks later. I was kind of mentally prepared. I wanted to take the vaccine with nothing. I didn't want to take any ibuprofen or Tylenol either before or after. I tried to stick it out. And for the first like 8 to 10 hours, I felt absolutely nothing. I was like, no, like maybe I'm out of the woods. Maybe I'll get by this. And sure enough, about 9-10 hours later, I started getting this kind of ill curtain coming down. And by 11 to 12 hours out, I was in bed, chills, fatigued, tried to stick it out, made it to about 11:30 that night. And I had had my vaccine at 10 a.m. I made it about 13 and a half hours before I said, nope, I'm giving in. I'm taking the Tylenol. And I ended up alternating Tylenol and ibuprofen throughout the night. I didn't sleep well. I felt kind of run over by a bus that following day, which was a Sunday. And then by Monday morning, I woke up and I was like, oh, like nothing had happened. I felt like a new woman. So thankfully, I had what I would call a moderate response to the second dose, like many, many people are reporting. And thankfully, it only lasted, 36 to 48 hours. I think that it is very important to be sharing and be transparent about our vaccine experiences so people know what to expect. They aren't blindsided by like, uh-oh, I didn't ask off for work. Uh-oh, I didn't line up childcare. If you're elderly and getting that second dose, do I have groceries in the house? Do I have things right by my bedside that I might need? Things like that. I think it's very important to share that now ahead of time so that people are prepared.
Right now in our world, there is so much information, and it can be information overload, and there's so much coming from different sources, and it's sometimes hard to tell who to believe. And if you have a family friend who's posting on Facebook, or your doctor is posting on Facebook, hey, listen, I got this shot and this is what I'm seeing, this is what I'm feeling, it wasn't that bad, that just gives a little bit more reassurance to the public that it's not just one organization pushing for something. It's really just transparent nurses, doctors, medical professionals, physician assistants saying, hey, I am here. If you have a question, I'll answer it. What do you want to know?
The reaction I've got from my vaccine story, it's been mostly by large part positive. I welcome all the vaccine hesitant questions. For people who are vaccine hesitant, I get that. 2 months ago, 3 months ago, I was too. I kind of dedicated a lot of extra time reading the research articles. You can't just go off what your Aunt Sally sends you on a Facebook link. Get the good source. If they're on the fence for no other good reason, then I just don't know yet, then just keep reading.
As a Nebraskan, I think it's really cool that her small portion of this study is going to be compiled to New York and all these other places. And the end of this study is going to end up being something globally that researchers, doctors will look at and say, hey, this can be passed along. And it all started with a woman, here in Nebraska, as well as hundreds of other moms across the country. Research takes time, so it could be a while before we see the results of this study, but we're hopeful it's sooner rather than later.
Once all that data is compiled, then they will be looking through the numbers. They'll be doing statistical regression analysis. They'll be getting all their data put together. They'll be writing and doing tables and graphs, and research assistants will be helping the primary investigators, and they'll have it peer reviewed. They'll be submitting it to journals, and then it will hopefully be published, I would hope, somewhere maybe by summertime.